Welcome to the Miracle Larry podcast. Hi, I'm Dr. Jack Cush, joined by Miracle Larry Kelly, and we have back a reprise special guest, Jessica Montanaro. Jessica, thank you for coming back.
Thank you.
You're a glutton for punishment or
entertainment. I am, especially with you two.
You put earrings on.
Oh.
And I can't.
Oh, wow. Who knew it was going to be a wardrobe issue? But anyway, so I want to talk about reunions and recovery. But when we last left off, Larry was still in the ICU and Jessica and her team was taking care of him. You know, the first, it was maybe a week or two weeks later that he was doing really badly. And his family got word, this does not look good. And they were not letting anybody in the hospital, but they called Larry's wife, his daughter, and his brother, said, you probably need to come by and get a last look and have your say your goodbyes. It was kind of sad and ugly. Larry, what did you learn of that from your wife and family?
Well, real quickly before we get to Jess, because that's really private and between Jess and my family, and that's a big part of our connection. Is that connection she made, thinking this was the end. And real fast, I'll just say that they weren't allowing anybody in the hospital except if they were going. They had decided that, if they knew the patient was not long, they let the family in at the end. And Dawn, when she went to the hospital, saw a sign out front that said, no one's allowed in unless, it was like this ominous sign, unless the end is near or something close to it. But just real fast, and I don't want to take up time, but I did not know they allowed, Jessica, I think, told Dawn that they could record on the cell phone. And I did not hear those messages. And I'll talk about that later after when I first heard those messages. I did not know what was said on the phone, but I'll throw that in later. But Jessica was the nurse that my brother, my wife, and my daughter. And Jess, you can take it from there.
Yeah. That was probably the hardest part, I think, for us, morally and ethically as nurses. You're supposed to, help people towards the end of their life, be with their loved ones. And the fact that we could not allow that was extremely difficult. And I'll just say during that time, for many of us, we became the mothers, the wives, the husbands, the friends, the daughters, the sons of our patients. And we were standing in proxy for them. I do remember Dawn. She was the first one I met. She came up, and at that time we weren't letting anyone in the physical room, and I can't imagine how difficult that is for a loved one, because I often tell people that I would be in handcuffs if it was my loved one in that bed. Like, don't tell me I'm not going in there. And there was glass doors, and Dawn was standing outside the glass door.
Dawn is Larry's wife.
Dawn is Larry's wife. And I remember her coming in, and I just happened to be on that day. I mean, I feel like I was there every day, but I was on that day, and she came in, and she told me who she was. And obviously I had this attachment to Larry. And so I walked her over to the room, and we stood outside the door together, and she was kind of in disbelief, looking at him for the first time. And she was recounting, she said to me, I was just yelling at him to put sunscreen on because they were just in Florida. How did this happen? She kept saying to me over and over again, how did this happen? Like, I was just yelling at him to put sunscreen on. And so that was her. It was always a lot to take in, and we just connected, she and I. And I think this is also documented somewhere, but she looked at me, and she was still, she still had like a lot of hope about her. It was the first time she was seeing him, and she turned to me and she said, "Did he flirt with you?" And I said to her, "No." No, he was actually really scared. And that is when her face changed.
Thank you for lying.
Yeah, well, it wasn't exactly a lie, but
You were
in
scared.
all seriousness, that's when her face changed, because I think she knows Larry's personality and what his demeanor is. And so when I told her that, that was like a serious moment there, but she was just in disbelief. And then I remember his daughter coming up and his brother sitting outside the room, very upset. So yeah, and it was hard for us as nurses to not let family members in the room. It was just really hard. They couldn't touch, they couldn't talk. They were just looking through glass at that time.
So no one could go in the room but the nurses and doctors. So what was the purpose of the cell phone, Jess?
So ironically, we have a rule, right, in ICUs across the board that you can't use cell phones, right? I think there's an archaic thought that like it interferes with our I know, but
It does.
with our medical equipment, that's like archaic. But a lot of times we do it for just quiet and just not having a lot of whatever. So we actually, it's very strict in the ICU, no cell phones. And obviously we take patient privacy very seriously. So when typically we feel that patients are incapacitated and they can't speak for themselves, we don't know that they want to be videotaped or have photos taken of them. So we're very protective of our patients who are nonverbal and who can't consent to those things. During COVID, that was the only lifeline that families had. So that all changed. It was families FaceTiming with other family members who couldn't come in to show them patients, or, FaceTiming to say goodbye. I have so many stories. So many stories, but that became essentially the lifeline, I think, between families and patients during that time. So all those rules were just kind of out the window.
So that must have been really hard for Larry's family, and I know it was hard on you because you and I talked about it as well. It's just gut wrenching, because that was.
I mean, Dawn and I cried outside the door together. You know what I mean? I think I was just crying everywhere, left, right, and center. It was just it's very hard, because at that time you have to understand Larry was not doing well. And by all intents and purposes, he essentially looked like the prognosis was going not well. And we anticipated that he would die. And so, that was hard to say you can look, but you can't go in. That's very hard.
Well, what I understand, Jess, is that you only allowed them up one at a time, and you took the phone in each time and put it to my ear.
Correct.
Yeah.
Amazing. So medically,
amazing.
Larry at the time he was intubated on a respirator, paralyzed. We didn't know if he how awake or if awake.
Correct.
He had severe pneumonia in both lungs where he needed the respirator. He had bleeding in his brain, in the tissue, in all hemispheres, frontal, temporal, parietal, occipital. He had brain edema, and he had nonstop seizures. This is an ugly, ugly picture.
Yep.
Sepsis.
Well, sepsis was the virus in your blood and in your tissues throughout the body. That's the definition of sepsis.
But yeah, I mean, Jack, just being a medical person yourself, I mean, just look at that picture. I mean, you prepare families for the end, and rightly so, right? Because didn't think that there was like a positive outcome from this.
So daily, when we got reports from Jessica and other medical staff who would call the family and then would also talk to me, and then we would discuss again, my story was always the same. As bad as things were, and they were progressively bad, it's like the good news is he's still alive. I don't know how. The bad news is, and then you start laying on the different layers of things that happened that didn't go right. And so we moved from ICU unit to ICU unit. There was like 3 different changes that were very upsetting to the family, because they were getting further and further away from Jessica, and that just drove them a little crazy, because they were going to a new unit. They didn't know how that was going to go. And then later, he was transferred to downtown to Beth Israel to called an LTAC, a respiratory care facility, and then last place he went was to the Jewish Home for Rehab. By now he's awake. But Jessica, in all the many days that he's intubated on a respirator, being moved around, did you lose track of Larry?
Obviously it was super busy. Like, so we were dealing still, like Larry was the, second patient. So there was still a massive influx of patients and a lot of chaos and a lot of exhaustion. But I have a good friend who I call like dad. His name is Lou, and he is a forever nurse. He nursing was his whole career. He's a fantastic nurse. And he retired and he came back per diem. And during that time, he was sent to that makeshift ICU. And if I ever had to be in that position, that's the man that I would want taking care of me. He is the heart and soul of what a nurse should be. And he took care of Larry. And he actually kind of, I guess, picked up on the connection. I'm not sure how he knew, but he would give me updates on Larry. And that was my only connection at that point. I never saw him in those ICUs. I never went down. I couldn't. I mean, there was just no way I could leave the unit. But he would give me updates on Larry. And that's how I kept track. I would ask, but Lou would come and tell me. And then it was one time, and honestly, Jack, I think you probably have a better timeline than I do, because it was all like, right. I don't remember a lot of dates, but it was one time that he came to me and he said, Larry opened his eyes and he's moving. And I went, yeah, right. Like, I didn't believe it just based on what I had seen. You know what I mean? There was just no way. But yeah, Lou was excited and told me that he was waking up. I don't think at that point, maybe he was following simple commands, but we still didn't know what level of, orientation or alertness he would have, or, whatever, cognition.
Jess, you had once told me that you would call Lou, but just to see if I made it through the night. I don't really, how's he doing?
I don't know if I called him. I know that when we were on, I would always ask about him. I don't remember if I called him, but I know that I would every time, because you have to remember at that time, those makeshift ICUs didn't have supplies that they needed.
Right.
So he or others would often come up to our unit just to grab what they needed. Right. And so he would come up and grab it. And so I would always ask. And I think that's probably why he knew to come to me the day that you woke up. And actually, I remember telling Dr. Wedderburn, who did your tracheostomy, that you had woken up, and he couldn't believe it. Like, there was just a lot of disbelief. I mean, I'm grateful, but I'm just saying, it was like, yeah, okay, trust but verify.
So again, Jessica had to do this job, and there was a time that there was someone who actually needed Larry's bed more than Larry, and he was sent to the next makeshift ICU, which there were many that cropped up in those first few months at Mount Sinai. It was a lot like building MASH units during the war.
Yeah.
And from the family standpoint, that drove Larry's family crazy. And I was really wondering, oh man, are they giving up on him? I hope not. I mean, we got to double down on praying and all this kind of stuff. It was just really stressful. But I'm going to now take you forward. Larry did open his eyes. He did move his fingers. He did, go to LTAC. And I think when you were about to go to, before you went to the rehab place, I called Jessica one day and I said, hi, Jessica, Dr. Cush. I don't know if you remember me. She goes, oh no, I remember you, Dr. Cush.
Yep. And it's ironic because you called the unit and I happened to be on. You just got me.
And I called to speak to you specifically.
Yeah, it's crazy. And you called me and I don't even think, I think he was there already, right? He was at an LTAC already. And you told me you just wanted to give me an update that he was actually doing well and he was awake and alert. And I took you with a grain of salt, right? I had never met you. You and I had just spoken on the phone. I appreciated the phone call, but I really didn't understand the level of wealth that you were describing. It almost seemed impossible. Sometimes family members or friends, they have this, he moved or he did this. And I'm like, okay, and then you said, do you want to call him? And I said, I didn't want to intrude. I don't like to do that. And so I remember giving you my cell phone number and saying, if they want to speak with me, they can call me, because I didn't want to intrude, and I didn't know really what was going on. So, and I think within minutes of our phone call, Dawn called me, and I was sitting in the ICU. I'll never forget. I was sitting in the nurse station, and Dawn FaceTimes me with her daughter. And, it was surreal. And so, but they were also FaceTiming Larry. So we were on like a 3-way FaceTime. They were FaceTiming Larry and FaceTiming me. I don't remember how it all happened, but I was looking at him through their phone. Whatever it was. And I don't remember a lot of that conversation. I remember being overwhelmed that he was awake and he was talking, and he was still.
Yeah, there was a lot of tears, I think.
There was a lot of tears, but you know what? I remember you telling me at that time, you were writing you go, I'm going to write this screenplay about this.
Really?
Yes.
You barely talked then.
Maybe you didn't.
That I don't remember.
But you told me you were going to write, maybe you didn't say screenplay. Maybe I'm making that one up, but you told me at that time you were going to write about this.
Yeah. On my end, I was, again, this conversation to me was to talk to Jessica was surreal. And yeah, she was kind of matter of fact about, well, like, really? Okay, well, yeah, I can talk to him. And then and I hung up, and the next thing I heard was we're FaceTiming with Larry. I think I cried the rest of the day.
Okay, can I tell one quick story? Dr. Raymond, because I use first names, but
I love him.
The man who did my trick. There's a whole story about when I went back with Jessica a year and a half.
Yeah.
Right? A year and a half after I went home was the first time I was back in Mount Sinai. And Dr. Raymond came over from the other side of the hospital, and there's a whole thing I talk about with that. But he came over to tell me this story. And I have to just repeat it because there's a big question. I was very lucid through much of the coma. Not lucid in the sense that I heard everything. Everybody says, you heard people? No, but I felt everything they did to me. And I interpreted that in very Criminal Minds type ways, It was terrifying, but I was conscious that I was in a coma. I was conscious that I was in a coma from COVID. And this thing, when Dr. Raymond came over, Jack and Jess, and, he said that he was called over to do the trach, and Dr. Myrna was there and Jess was there. They're on each arm. And when he's telling me the story, and he said, Myrna called me over to do your trach, and I'm reading your charts and I'm looking at you. And I said, Myrna, why am I here? This man's gone. And Myrna, and you were, get my trach out of me, get my trach out of me. And said, why, Myrna? I've got other patients. This man's, and she said, get my trach out of me. And I keep thinking, Dr. Myrna, my God, if she's not insistent, I'm not here, And he said, Mr. Kelly, I have to tell you this story. He said, I put my finger in your hand.
Yeah.
I said, I yelled, squeeze my finger. And you squeezed my finger. He said, I give you a tracheotomy. And if he walks away, I'm not here. If Dr. Myrna doesn't insist, I'm not here. And the reason I talk about the finger is because in the coma, it was a lucid moment, and I connected. When he told me that story, it sort of blew my mind, because I was in the coma and I said, they think I'm dead. They think I'm dead. So I must have heard them talking. That's one of the things. They think I have to do something. I have to do something. They think I'm dead. And I thought I was in a coffin. I said, well, maybe this is a coffin. Maybe they buried me. And I'm trying to figure out, I got to do something. I got to show them I'm not dead. I said, I swear to God, this is true. I said, I have to wiggle my fingers. And it had to be when Dr. Raymond screamed at me to squeeze his finger. I had to have heard, because I remember that so distinctly. So that is so incredible to me that
I'm going to piggyback on that story because, first of all, I just have to say, the two people that you mentioned are phenomenal clinicians. but aside from clinicians, humanitarians
Mm.
who care so much about human beings and their lives. I mean, you have the two people, Dr. Mohanraj, Dr. Wedderburn, they will forever be my heart and soul, forever, forever. And so you were so blessed and lucky to have them, because they are just beyond clinicians, humanitarians, right? And so, and they have both taught me so much. But I'll tell you, when you came to visit that day, which was impromptu, it wasn't planned. You were across the street for a neurology appointment, so it wasn't like we planned it. And when you came in, I texted Ray and I said, Larry Kelly is here. And he was in the OR and he was about to operate. He was like getting ready to operate. And he stopped and he said, I'll be right there. And he left the OR to come over to see you. Like, he left what he was doing to come over to see you. And I said, he's not going to be here long. And he said, I'll be right there, you know? And he told you that day, you're the reason why we do what we do, you know? And he wasn't wrong. And those two people have the most beautiful souls. I will forever be eternally grateful for what they have taught me and the love they show to their patients. I have never worked with better physicians in my entire life, ever.
Jack, that was such a heady day when I went back to visit, and Jessica's got one arm the whole time because I was still a little shaky walking it. I wasn't like I am now. It's harder for me to convince people I went through this stuff. But Jessica was on one arm and Dr. Myrna was on the other, and walking around in the staff, and it was I was like crying and
if you
them.
remember, what was ironic was that like some of the significant people in your life were all working that day. So
Lou was there. Lou was there. He had retired.
Ray, Dr. Wedderburn was up. Melissa was there. I mean, people that like Dr. Fung, people, you know, and Lou was there.
And Lou was there. He retired.
Like, but think, and I remember saying, I could not have staffed this better.
I know, you said that
if we had planned it. It was just ironic how you showed up.
I was
and
across
like
the
all
street.
The significant people in your story were all on that day.
So Larry, again, you're out of the hospital a number of months.
Jack,
Tell a story about the Zoom call with the whole staff. You're out of the hospital. They asked you to do a Zoom call with the medical staff, right?
Yeah, I think it was you or Dr. Myrna. One of you called me up to do that webinar in September. September.
All right, so I have to go back. No. He doesn't get to say this, Jack. I'm sorry. I'm taking control here. So here's the deal. You asked something when you started this, and you said what was the most significant, whatever. So the thing for me, aside from getting to know Larry and having a relationship and all that stuff, was that I was so struck by Larry's account to me, how he remembered things while he was in a coma, right? So as clinicians, you walk into a room and you see a patient who's unresponsive. And I always knew this and I always tried to do this, but this drove it home for me, was that you just never know what people hear or understand. And Larry would recount to me that like, I would hear you talking about my prognosis or being brain dead. And obviously he translated it into more nefarious things in his state, in his condition. But he would hear that stuff and he recounted how like every time we drew blood, it felt like, you know, and Larry, that's your personal story, so I'm not going to share all that. You can share it, but you know, that when we would prick him with needles or we would do certain things, it felt he interpreted it a certain way. And that was so significant to me. And I remember asking Dr. Shapiro, our medical director, and Dr. Mohanraj, and they both lead the ethics committee, and they both train all these new doctors. They're phenomenal. And I thought we should bring you back to have you talk about that, because I think there's so much to be learned when you touch somebody who's in a coma, or you think is in a coma, or, you know, someone's end of life. You don't know what they feel or they can hear or what they're interpreting. And I have taken that very seriously in my career. It just drove it home for me after Larry. And I try and teach my students that, and I teach new nurses that. And I tell family members all the time, like, I don't know what he can hear or she can hear, but speak to them like they know what's going on, you know? And so that was so significant to bring him back and let him share that with the doctors. And I think it was just such a profound.
It was the September after I came home in July. It was that September.
Yeah.
So I was still.
You were.
But Jess, you were always, after I talked, you go, you are amazing. You are amazing. Like, I said, what'd I say? I said, well, what did I say? Because I was on automatic pilot, Jack, at that point. I was just, you know, I remember saying, all these doctors and nurses sitting in these tables, I remember saying, you know, I can self-assess, but I'm just going to say what happened and you guys interpret it, because it doesn't mean anything for me to self-assess. I'm trying to piece it together as it is. But that was really,
it was powerful.
It was really the first.
How did you begin the webinar, Larry? You opened the webinar. What'd you do? What'd you say? First question.
I have no clue.
You told me, before I start.
I said, so, well, there was like I had 2 or 3 dozen doctors and nurses sitting in horseshoe tables around these 2 tables, and me, like, you know, on the screen, I guess, you know, and I just said, before we start, can you raise your hand if you worked on me? Every one of them raised their hand. It was it's pretty weird. It was so I said, thank you. I've been back to Mount Sinai, and outside is a huge picture of Dr. Myrna and Dr. Shapiro. And you're not there, Jess. I was so pissed. I was like, what is Jess?
I have too much of a mouth.
It's
e pluribus unum. From many comes one, Larry Kelly.
But it's all about COVID. So they have this quote from Dr. Myrna during COVID. They have this quote from Dr. Shapiro, and I'm like, what's this?
Listen, those women are phenomenal.
I know.
They will be forever my inspiration. And I was just so lucky to work with those 2 through this.
So what's the first time that I know you've gotten together several times afterwards. What's the first time you got together face to face? And
again,
Jessica, how do you bring that about?
Back, I'm taking this one.
All right, go ahead.
So ironically, Mount Sinai had the forethought, which was pretty amazing at the time, to allow this to be filmed. And during the early months, I actually wore a GoPro on my body. It was a camera on my body because they wouldn't let the film crew up. And I just have to, whoever made that decision really at Sinai was amazing. And people ask me all the time, like, did you get paid for this documentary? And no, I didn't. But it was so important to me to get a message out about what was really happening, because I feel like a lot of the country wasn't experiencing that. And and they thought we were crazy and I needed people to see what was happening. And that was my whole motivation for it. But I wore a GoPro. And eventually they let the camera crew in. And so I remember talking to Johnny Caps. He was the producer, phenomenal man who took this so seriously and really was attached to it. And I remember telling him about Larry. And I said, you need to get in contact with this patient because he survived. And this was the story. And I told him the story. And so I asked Dawn, I think, or whatever. And I somehow I hooked you guys up. And so they wound up following Larry, and the first time ever really that I would say you were lucid and that we had a connection, for me anyway, was when you were in the rehab and the film crews were with you and you guys FaceTimed me and I was in the hospital, and it was the first time and I was overwhelmed because you were sitting up, you were talking, obviously you're fine and gross motor skills still needed some work and you needed assistance, but you were like beyond what I ever could imagine would have happened. And what stuck out for me during that conversation, it was the first time we spoke, I was so overwhelmed, but you said to me, that's what you look like. But here's the seriousness. It never dawned on me that you didn't know what I looked like, because I knew what you looked like, but I forgot that I was always in PPE when we were
Your
together.
eyes. You want to talk about your eyes? I can tell you.
No, but do you know what I'm saying? Like,
Yes,
it's
absolutely.
really significant because it didn't even dawn on me that you did not know who I was.
Mhm.
You know?
Oh, I knew who you were. I just didn't know.
What I mean,
I
like,
just
you couldn't
didn't know
pick me
without
out
the
of a
mask,
lineup.
without the stuff on. I
Hey,
didn't know
Mano,
what your
you
face
couldn't
looked
pick me
like.
out of a lineup, okay?
I
You
know.
didn't know my face. Okay. All
I
right.
couldn't have.
Point made.
All right. So then how do you make the decision to get together and actually break bread?
I think during that Zoom,
His memory sucks, by the way.
Well, he was brain dead.
I think during that Zoom, I said, we have to go for coffee or something, right?
No, remember, you would say, was it the Portuguese or Hungarian?
The
Which one?
Hungarian pastry
Hungary,
shop.
and I always said Portuguese, and you were like, "You got it wrong."
I know it's Hungarian pastry
Yeah,
shop.
like you always got it. I always got it wrong. But
My
no,
memory, huh?
I think we just texted a lot, and then I think you invited me over for dinner, and I brought dinner with
right.
Paul and I and Francesca.
Yeah.
We came over to visit at your apartment in the city for the first time. That was the first time we got together.
Her daughter was my first child fan.
Yes.
She was like so great. We're gonna help you.
Oh, a younger demographic. Who knew? But Jessica, that's unusual to have. And I've done it many times in my career too.
Yeah.
To extend your personal life beyond your work life to someone who you met through medicine.
Yeah,
And
it doesn't happen often.
no, and it's I would say just I wonder what your thoughts on this are. There's something bigger. There's a deeper connection. There's something special about this, and it's it's we're beyond the time when it's probably not safe and not wise, and so it is safe, and ultimately because there's something special about it, it's a wise, really special thing to do to reach out like that. But do you know what it was that made you do it? Was it Larry's tattoo? Was it the
Nice, Jack. No.
She proned me, remember?
Oh, well, yeah. And she can prone you again. You better be careful, buddy.
Yeah, I have skills.
Yes.
No, it was I think he was just significant considering, the events that went on. And I've gotten close to other family members over the years. Like you can't, as a healthcare professional, be involved in someone's most vulnerable time of life, whether it's the patient or their families, and not get attached in some way. I mean, so typically what happens is that patients come back to the hospital and visit, and that's not uncommon. And in fact, Mount Sinai, Morningside, under the direction of their trauma team and Dr. Wedderburn, have a trauma survivors day. And we get to see all our patients who survived these crazy traumas. And it is overwhelming.
How wonderful.
It is overwhelming. Oh, I'm sorry. For us, it is completely overwhelming because you see people that you in their worst, and then you see them at their best. And so this was different because I think we understood that Larry couldn't really leave the apartment or whatever. And I had made a connection with Dawn. And so it just felt natural. It wasn't anything.
Well, I try to explain to people with Jess is I think unconsciously though, we knew, I knew, and I have a feeling she did too, that we were involved in something historic.
Yeah.
That there was this.
It was unspoken.
This is that what was happening to us in our encounter, and she knew. We've talked about this, but she knew through me what the next 3 months were going to be like for her, and and I knew through her I was going somewhere that was going to be hell to get out of. And I think it's like she was talking about earlier, that it's hard to explain to people. We can talk to each other, and we know what we're talking about. I mean, Jess, I talk to terminal patients now, and I know what they're thinking.
Yeah.
I know what they're thinking. I know what's going through their mind. And it's like, it's hard to explain, but I'm very comfortable around terminal patients. It's like, I'd rather go out to dinner with a terminal patient.
I know.
But it was just, Jack, it was the moment. It was so early. It was so early.
Yeah.
Because no one knew what this thing was. No one, and
That probably was
but we had a premonition. Wow, this is
it was the solidifying bond, probably. I mean, really, the thing that was like, he was my second patient. There were so many significances, and then he survived. And not just survived, but thriving. You know what I mean? Like, what?
Jessica told me you were one of the few bright spots during that whole time. That everybody was dying or going home or whatever, Anyway,
Jessica, the statistics are early COVID. I think the numbers were something like anybody got COVID, a 1% chance of death. If something else got you, if you were admitted to the hospital, it was at least a 10% chance of death. If you were admitted to the ICU, it was now like a 30 plus chance of death. If you had any comorbidity, overweight, high blood pressure, diabetes, I think being male, now you're up at a 45% chance of death just by that scenario. Forget about what's going on with you. And that's what in the last episode, Jessica alluded to that by saying that he was fit, that he didn't look like he's someone going to crap out right away.
I regret that statement forever, but go ahead.
Yeah. So, but it's funny, it's
see me now.
It's amazingly true. Yeah, you're still look wonderful, Larry. And but I want to ask you, at the time that in that ICU with all that bustle, how many people actually survived in the first month? That anyone wheeled in?
I mean, Jack, you're so much better at the statistics than I am. Like, right. you were tracking all this. I was living it in a different way. So I didn't have that, but I can tell you that there was a period of those 8 hell weeks that I would hear an emergency or a medical code called overhead every 30 minutes.
Oh, and that's unbelievable. When you're on, even in a unit, you might only have one code a day or every other day. Sometimes.
No, not even a day. I mean, not even a day. And it was every 30 to 40 minutes.
Oh my God.
There was a rapid response or a medical code or
for months, right? For months.
And it's interesting because when you're in charge of an ICU and you hear that in a hospital overhead, you prepare, right? Like as the nurse, you're like, okay, I need to get a room ready in case things go south and I need to make sure this is good. And I didn't have any beds.
Yeah.
So you hear it and you can't take anybody. So it's like, what's going on the floors and it wasn't good. And, I have a couple doctors, they were residents and fellows at the time. And it was like Dr. Mohan Raj, Dr. Davidovich, Imran, and there was 3 of us. Dr. Shapiro was sick. And so she had COVID and she was out, and it was the 3 of us, and they would be working these floors. I was in the ICU and they would come up with just drenched shirts, were drenched with sweat, PPE. They were just running and running and running. And it was unbelievable. I can't even really explain it.
Yeah. Well, and it's the contrast to what we're hearing and seeing now makes it all the more unbelievable. But I want to end with each of you telling a story about the other, getting face to face a few times after hospitalization, after your documentary. Was there a story or something the other one told you that blew your mind or is most memorable to you? Jess, do you remember something that Larry told you or?
Yeah, I said it, and this will be the thing I take away forever, because I think it has impacted just how I function as a nurse and how I instruct families and I teach nursing, and how I instruct my students is Larry's account of being aware, whether through whatever interpretation he was having, rightly so, but being aware of what we were saying and doing and feeling. And I wish I could bring that more into a tangible form in a clinical setting, so that as clinicians, we understand better that we don't know how people are interpreting or feeling what we're doing, even if they apparently look like they're unresponsive or in a coma. And I think that is so significant for so many people. And I wish I could make that a bigger message somehow to an ICU crew nationally, because I think we have to be very careful how we approach these people. Because we assume when you look at someone who's not moving in the bed, who is not responsive to anything, that they don't know what's going on. And that was the most significant thing to me, I think, that impacted me in terms of my professional life. Obviously, he and I have a friendship, and Dawn and his beautiful family, and I get to watch all this, which has been amazing. But that's clinically, that has been the most significant to me.
Larry, do you recall anything?
I have to go back to what I said, I think the last podcast. I'm confused now because this is the first double one. But when I was in rehab, and I had a big image of Jess when I was watching on TV, and and watching George Floyd say, "I can't breathe," and I thank God every day that I ran into Jessica Montanaro, who said, "Okay, I'll help you."
It was our team.
Yeah.
It wasn't just me. It was our. I'm just the face you remember, but honestly, it was our team. I couldn't have done it without any of the people we just talked about.
Yeah, absolutely.
I just happened to be like in your face.
I remember during that webinar, I did say, because I had counted, Jack, 10 days, or just, I don't know where that came from. I said, oh, this is day 10. Okay. It felt like 10 days and they told me it was 51. And so I think I said at the webinar, all right, so if you use simple math, maybe the patient is lucid 20% of the time. So really be careful what you say around the patient. Don't say anything that's not lollipops and flowers, because for me, it was weird, Jess, because I couldn't process. I'm a man who has to process things, and it happened so quickly that I just got the message that Jackie had COVID. So I was in this terrible head.
I know.
Was vented. I was in so I went into the coma negative to go in, and so I don't know. People say that the question of whether I ever crossed over, I don't know, but I can tell you this: I didn't see any white light. So if I did cross over, I wasn't where everybody thinks you go. I had to talk my way out of the other place.
But you often recount in your story about internally fighting, right, in your mind, and willing yourself to live and willing yourself not to give up. And and again, it's not my story to share, and I'm sure you should do a whole different podcast, honestly, on. You really should, on what your experiences were, because I think as clinicians, we actually can learn from that. And so let me just give you an example. Like, a small takeaway is, it's very common for a nurse or a doctor to go into a room because we're so busy, right? We have so much going on. Like, I'm just going to flip you over and I'm just going to stick you with this needle and I'm going to get your blood and whatever. And it's very important to say, Mr. Kelly, I'm about to draw your blood. That's what you're going to feel right now. I'm going to stick you with a needle, right? I mean, I think that is so much, and obviously that could not happen while you were there. I mean, we were just like trying to survive ourselves. But if there's a lesson or a takeaway, right, aside from all we learned from COVID, but I mean, I just think like how impressionable, we don't know what people feel, hear, or interpret when we think that they're not conscious. That has been significant.
and I think I always wanted to ask you, Dr. Myrna got very into narrative medicine.
Yeah,
Um,
baby.
right? And that's her thing. And,
That's
I joke with people that one of the reasons I survived is because Jack sent all that food to the staff. And my daughter, she worked for Estee Lauder, and they sent products, and the nurse is like, "Who the hell is this guy? I don't know. Keep him alive. I don't know. Keep him alive."
No.
So, I had an image of him going, "Monique, what is this? What is this? Mr. Kelly, who the hell is he? Who the hell is he?"
Those are momentary satisfactions in a really difficult day. So
yeah.
I know.
But all right, folks, I want to say from out of the darkness, Larry Kelly walks out of the hospital, renews his life, makes new friends, but a new best friend forever in Jessica.
Yeah. Definitely. Even when we fight, and guess what? We fight now. How
Yeah,
many
so-
years is it?
That's right.
Now you know he's normal.
Larry, what's it, like 3 years now we're friends, right?
She's like a
20
dominatrix now. She's like a
Yeah, now we argue. So it's very
You need a
normal.
beating. You do need a beating. All right. All right.
Jess, we'll
right.
talk soon. We'll talk soon.
Ciao.
Thank you. Thank you for doing
Thank you
this.
for this.
Like I said last
Both of
time,
you.
love you both.
Love you.
Always love you.
Yeah.
Bye-bye.